Today we're going to do a cranial nerve exam.
Okay.
All this is going to involve is I'm going to touch you a little bit. Is that okay?
Mm-hmm.
All right. So I'm going to be looking at the symmetry and strength of muscles in your face, your jaw, your neck, and your shoulders. All right?
Okay.
So the first thing I'm going to assess is the motor functions of cranial nerve 5. Cranial nerve 5 controls the muscles of mastication or chewing, like the masseter, the temporalis, and the pterygoids. So, all right, I'm going to touch your face, okay?
Okay.
All right. So I'm going to put my fingers right here. Go ahead and bite down real hard. Excellent. So I'm looking for symmetrical bulging in strength and size and everything of the masseter muscles. All right, do the same thing with my fingers up here. Excellent. Same thing, symmetrical bulging and strength on both sides. All right, open your mouth, please. All right, so here I'm looking for, is there any deviation indicating that one side is stronger than the other? Does the jaw hang to one side or the other? All right, so I'm going to push up on your jaw. Don't let me push your mouth closed, okay? Ready? Great. All right, go ahead and close your mouth. I'm going to do the opposite now. I'm going to pull down on your jaw. Don't let me pull it open, okay? All right, fantastic. If I had been able to pull her mouth open or push it closed, that would have indicated muscle weakness. All right, and for the sensory portion of cranial nerve 5, all right, so what I'm going to be doing is I may or may not be touching your face.
Okay.
So all I want you to do is tell me when you feel me touch, okay?
Mm-hmm.
I'm going to do this with my tongue. All right. Again, just let me know when you feel it touch, okay?
Yep.
All right.
Yep. 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 Mm-hmm.
All right, excellent. All right, and again, that was just testing the sensory function. And if she weren't able to feel it on any portion where I touched, I might test again to see if she could discriminate between, am I touching with one or two fingers? Am I touching with the sharp side of something or the dull side of something? Just touch discrimination. If she weren't able to feel any of it, it would suggest some sort of lesion with the sensory portion of cranial nerve 5. So next I'm going to do cranial nerve 7. This innervates the muscles of facial expression. So the first thing I'd like you to do is raise your eyebrows like you're surprised. Fantastic. So I'm going to push down on them. Don't let me push them down, okay? Great. Clench your eyes closed tight for me. Okay, don't let me open them. Excellent. Smile for me. All right. Looking for symmetry in the nasolabial folds there. Purse your lips and puff your cheeks out for me. I'm looking at auricularis oris and the buccinator muscles. All right, so I'm going to push on your cheeks. Don't let me push the air out, okay? Fantastic. All right, so if at any point I had noticed that there was hemiparesis or an entire half of her face was weak or wasn't functioning, that would suggest an ipsilateral lesion of a lower motor neuron. If only one side of her mouth was weaker or wasn't moving, that would suggest a contralateral lesion of an upper motor neuron. All right? So there's no sensory portion of the, we're not going to do a sensory portion of cranial nerve 7, so I'm going to move to cranial nerves 9 and 10, innervating the pharyngeal muscles. All right, so I need I'm going to be looking inside your mouth.
Okay.
All right. So pretend you're at the doctor. Go ahead and open your mouth. Fantastic. I'm going to move your tongue out of the way a little bit. Can you say ah? Ah. Great. Repeat after me. Ha, ha, ha. Ha, ha, ha. Great. Okay, you can rest for a second. I'm looking for symmetry inside her mouth. Like whether the uvula is deviating to one side or the other. If the uvula is dangling to one side, it could suggest weakness on that side, and that would suggest a contralateral lesion. All right. So for the sensory portion of 9 and the motor function of 10, I'm going to test your gag reflex, okay?
Mhm.
Don't worry. I'm not going to like stab you in the back of the throat or anything.
Okay.
Go ahead and open your mouth. And I'm trying to touch the fascial pillars and the fascial arch. However, presence or absence of a gag reflex does not really affect a patient's ability to swallow. So having just done 9 and 10, we're going to do 11. And this part is, I told you I was going to touch your shoulders.
Mhm.
All right. So go ahead and raise your shoulders up like you're trying to touch your ears. I'm going to push down on them. And again, if anything hurts while we're doing this, let me know and go ahead and stop. So I'm going to push down. Don't let me push them all the way, okay?
Mhm.
Great. All right. So turn your head all the way to the right, or as far as is comfortable. I'm going to put my hand on your chin and try to pull it back. Pull your head back to the center, okay? And don't let me do that. Great. All right. Same thing on the left side. Fantastic. So what I was looking for there is if I was able to pull her head back to center from either side, or if there were asymmetry in her ability to raise or keep her shoulders up. If, for example, if her head were turned to the left and I were able to pull it back to the center, that would suggest weakness in the right sternocleidomastoid muscle. So it would suggest a contralateral lesion. All right, so the last thing we're going to do is cranial nerve 12, and that's the muscles of the tongue. We're only going to do the motor portion. There is a sensory portion, which is taste, where I do sweet on one side, salty on the other, but we're not going to test taste today. So all I'm going to ask you to do is first just open your mouth, let everything lay like it normally would. And what I'm looking for is any abnormal fasciculations, which are twitches, jumpy movements of either the whole or one side of the tongue. Or if one side of the tongue looks exceptionally ridgy or bumpy, or any signs of atrophy, which would suggest that that side were weak, and I would be looking for a lesion on the contralateral side. All right, stick your tongue out at me. Fantastic. All right, so what I'm going to do is I'm going to push back towards your mouth. Don't let me push your tongue in, okay? Great. Stick your tongue all the way to the left. Don't let me push your tongue back to the center. And don't let me push it back into your mouth. Great. Same thing on the right. Don't let me push to the center or back into your mouth. Fantastic. So with the tongue movement, I'm looking for any sign of, again, weakness. If when she stuck her tongue out, it deviated to one side, or she wasn't able to move it as far to one side or the other, or she wasn't able to push back against my tongue depressor, that would suggest weakness, which again, weakness on one side suggests a lesion on the contralateral side. All right, we're done.